This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.
Talk Radio 1210 WPHT, WPHT HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
We promise to keep you warm during the next hour, okay?
I don't know, John.
So if you're wondering about that, good morning and welcome to another edition of Health Watch every Sunday, 8 till 9, right here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with the one and only Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. We're going to talk about the who, what, when, where, why, and how it can help you potentially, you and your family, improve your quality of life. We'll do that in the next hour right here with Dr. Molly. And our number here in the studio, if you have a question, 855-839-1210. That's 855-839-1210 at any time during the course of the show. If you have a question or a medical challenge you want to run by Dr. Molly, feel free to call in at 855-839-1210. Good morning, Dr. Molly, and nice to have you in good health today.
I'm much better this week than last week. I think I had one of those dastardly flu type situations. But you know, when you meet as many people as I do through the free consult, John, you know, people come in and they have the sniffles or whatever.
Yeah.
And unfortunately, you know, even though I have a recirculating air filter in our clinic, it happens. So but I wasn't down for the count.
No, you weren't.
No.
What's that saying about the shoemaker?
Oh, yeah, the shoemaker with no shoes. But I will tell you, you know how I believe in what I do. I believe in taking what I do the way you do.
Yes.
I mean, you know what, John? I believe you couldn't host this show if you weren't my patient.
That's right.
I know that's true.
I would say that's true for any show I do.
Yeah, I know that. I know that's true, John. So I appreciate you, and so do the patients. They appreciate you, too. I see how they all want to come in when John's coming in. We try our best to do it, okay? It's like having a celebrity
I'm only one person, and I'm only here 2 days a week.
I know, but people want to come when you're here, so we know. We get it.
So Innovative Medical Associates, what do you do? Because, you know, it's a question every week.
Right. It's a question every week because people are tuning in at different times. So the bottom line is Integrative Medical Associates is exactly that. We're a group of like-minded healthcare providers who really can do anything that any primary care facility can do. They work out of my facility, and we can do anything. So if you come in and you have the flu and you need Tamiflu, we can prescribe Tamiflu. The docs I have will be able to do that. But it's the philosophy that makes us different. Our philosophy is we want to provide service to people to effectuate the change of their medical challenge without the side effects or reducing the side effects of the conventional pharmaceuticals. For example, you take the high blood pressure medications for folks. We might be able to use a particular amino acid to help that, which is a natural product, to help reduce your blood pressure. The idea is, though, it's our delivery system, too, that makes it essentially better.
You deliver through hydration.
Through hydration. And why do we do it? Because most people fail on looking at the vitamins, the minerals, the amino acids, and other things in the health food store to really promote the result that they're looking for. But they don't get the therapeutic value, or they're not getting the full constituent that will do the therapeutic job. And we found that hydration therapy, which, by the way, is a traditional medical therapy. Everybody knows when you go into the ER, what's the first thing they're going to do? They're going to give you an IV.
That's right.
So it's a traditional way to deliver pharmaceuticals as well. When you want to get the therapeutic level to work for a particular patient. And that really separates us from every place else.
You know, it's interesting how many times we talk about this and people still don't quite get it.
It's very difficult to get it.
How can we help them get
well,
it?
Here's how we help them get it. We can do primary care functions. In other words, if you come in and you already have a diagnosis or you're not feeling well and you've been a long time, I see a lot of patients who have chronic conditions, John, chronic conditions, meaning I see people who have autoimmune conditions. I see people who have cancer, which we believe can be an autoimmune disease. So they come in and they already have their diagnosis and they may be treating. They may actually be treating on pharmaceuticals, but they're plagued with not only the condition, but sometimes the side effects of the pharmaceuticals. And what comes first? There's the answer.
That's the
so
problem,
we help a patient reduce their need for the pharmaceutical and then augment with the natural product by using the hydration. And how do I know it works? Well, we have the ability in our facility to do laboratory. In other words, we can send it out to the 2 big laboratories. I don't need to tell you who they are, but I have one of them right in the facility right now. And we can use both of those. And we can show you in quantitative data. You come in, you had a high white count, you do some of our treatments. Assuming it's a bacterial infection, at the end of this, your white count is back to normal. That's quantitative.
What I wanted to ask you is, are there side effects to the
nutraceuticals? Of course there can be, but in 28 years in October, I can tell you that our side effects have been very minimal. Usually maybe a little bit of a low blood sugar sometimes, but again, it's because of the ability that I have to run your blood work, check your kidney functions, make sure you're a candidate. I have, the joke now is I have 2 doctors, no waiting. In other words, I have 2 physicians who review what we're doing here and say, okay, this patient certainly is a candidate, And I see blood work when people come in. The most important thing that people can do is bring in their data when they come for the free consult, because that tells me whether we can help you or not. John, you've been there. You have seen, I told people, listen, this is not the place for you, right? I've done that. I've done that. But
definitely.
I'll tell you what, if there's something we can do, and I think my mission statement as personally is, if a person needs help and we have the ability to help that person, I want to do it.
Talk about, you were talking about side effects. And
sure.
There are many, many side effects to just about every medication.
Yeah, just take it with you from the pharmacy.
You're right.
Right?
It's a book.
Yeah, it is.
Really is.
Now it is a book. Now it is. And there are so many new designer drugs out. And, look, when you need the drug, you need the pharmaceutical, you got to take it. I never tell anybody get off their medication. You have to get off your medication if it's appropriate for you, if it's medically appropriate. And therein lies the rub. But isn't it interesting? So many times I see people come in with these dosings that it's like giving, what it's like? It's like having an assault rifle and you're hunting rabbits. Sometimes I think of it this way.
Yeah.
They got to give you the big guns first. There used to be a way where people would start a patient on a smaller dose and bring them up if they needed it. Today, I feel like everybody comes in with these mammoth doses, and is it good? And are they really feeling the benefits of the pharmaceutical, or are they just feeling the side effects?
Yes, and that's what you try to do.
Right.
Is replace
some of it reduce it.
That's right.
And the bottom line is, I think we're fairly successful at that. But we never, ever, my physicians do no harm first. Do no harm. We would never tell you throw away your antibiotic when you need an antibiotic, especially the last few months, right? Everybody has come in and needed a Z-Pack. But I've seen people come in and said, well, I've had 4 Z-Packs, Dr. Molly. I said, well, now, that may be a little overkill, right?
Yeah,
Maybe now you've just eradicated all your normal flora, and what we have to do is bring that back. So, there's a lot of ways to look at this, John.
Believe it or not, this show is really flying by. We're coming up on our first break of the morning already. Time flies when you're having fun. It's Health Watch every Sunday, 8 till 9, right here on Talk Radio 1210 WPHT. The number here in the studio, 855-839-1210. That's 855-839-1210. What do we say at this point of the show? Every week we say call early so we can take a lot of time and really delve into your problem. 855-839-1210. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Dr. Molly and I return with more of today's edition of Health Watch after these words. Operators are standing by right now at Innovative Medical Associates, and the number 856-489-0505, 856-489-0505. Tell you what you do. If you call, when you call, all you do is make an appointment with Dr. Molly for the initial consultation. It is complimentary, so it doesn't cost you anything. And you will find out a lot about what Dr. Molly can do for you, what she does in general, and how it can help you overall improve your quality of life. So do that for yourself and your peace of mind, really. 856-489-0505 is the number. And the website, innovativemedicalassociates.com. That's innovativemedicalassociates.com. Check it out. It's a good website. The number here in the studio, 855-839-1210. It's Dr. Molly and yours truly with more of Health Watch today. And, you know, Dr. Molly, the thing is and the thought is, and we always talk about this, vitamin C.
Right.
And I always say it. I always say, I get my vitamin C treatment.
Everybody loves vitamin C,
yes.
right?
But, I mean, you're much more, and your facility is much more than vitamin C, and we're going to talk about this.
We are, John, and one of the reasons why I want to do that is because I want to talk about the difference between us and spa-like places that are doing IV therapies that have just shot up all over the country, right? Now, in a place like ours, we have many more types of vitamins. One of the things I want to talk about today is vitamin A. So vitamin A, everybody knows. Do you remember when we were kids? Who was always eating a carrot? Remember?
Bugs Bunny.
Bugs Bunny, that's right. And what did our mothers always tell us?
What? Oh, my mother. It's good for your
God.
eyes.
You better eat those carrots, right? It's good for your eyes. Well, guess what, John? Mom was always right. It is good for your eyes, but it does more than benefit your eyes. And interestingly enough, there are two forms of vitamin A. Most people don't get that. So, yes. What else can vitamin A do? It's necessary for growth, reproduction of skin, cell division, and the integrity of your immune system, which you know I work with a great deal. Autoimmune diseases. Yes. So it's found in two forms. Everybody knows about the active form is retinol and beta-carotene, which Bugs Bunny used extensively, all right?
Yes.
So one of the things we do is we have people talk, and there's been huge commercials out about age-related macular degeneration and night blindness and overall poor health. Well, maybe there is a decrease or you have a genetic reason why you may not be able to utilize your vitamin A. So there are many reasons that I look at the aqueous vitamin A for my patients, and we do have things for macular degeneration. And John, if you remember, and you go back with me 20 years, you remember I used to see a lot of macular degeneration.
Yes.
Now that has somewhat slacked off because there are so many new improvements in terms of traditional medication. But I will tell you this, the bottom line is it's still vitamin A, along with some of the cofactors, which are zinc and copper, really can show to reduce the risk of advanced macular degeneration. And the study was done in Italy, and as a result, it has been also done here in the States. So we definitely want to look at vitamin A for your vision. The other reason why vitamin A is important is it's an effective antiviral and antibacterial. Believe it or not, it plays an essential role in cellular differentiation. That means that vitamin A is necessary for maintaining innate immunity and the ability to generate natural immune cells in the body. You and I talk about that all the time. If our immune cells are not working properly, what happens? You succumb to several things.
Many things.
Many things, right? And what else it does, too, it regenerates the mucus barriers damaged by infection. So, when you're telling me you're blowing your nose all the time, my patient's coming in, I feel mucus in my chest. Well, guess what? It's really improving your mucus membrane on a cellular level, and that's really important because it really plays a role in the development of T and B cells that fight infection. How about it boosts just bone health? Did people know that? We always talk about what? Vitamin D with bone health, but we don't talk about vitamin A. A alone can't improve bone health, but when used with D and K and calcium and magnesium, it definitely helps improve your bone health. So again, look at this, and I want people to go back to what I talk about Goldilocks all the time. Not too much, not too little.
Just enough.
Just enough, and used in combination, it can promote good bone density. Study on that was done in Italy, actually. That's why I love so much of the European stuff, because they do the studies on more natural products. We tend to do more and more studies on what? Pharmaceuticals.
That's right.
But there's a lot out there. How about it promotes reproductive health? How about that? And actually, this is an interesting thing, because I had 2 cases in 28 years of folks who had some trouble conceiving. And in both cases, when we ran the blood work, they had vitamin A deficiencies. Now, here's the problem, too. If the status of an expectant mother is in excess vitamin A, it can contribute to what? Birth defects. So guess what? Here's Goldilocks again rearing her ugly head. You've got to use vitamin A just right. The other thing that vitamin A is good, its need for tissue repair. We know for wound care. And again, preliminary studies show that supplementing vitamin E in the diet, and particularly using it by IV, has really helped the healing process following surgery. You and I have spoken about this before, because I have a lot of post-surgical patients who come in who say, geez, I want vitamin C. Yes, you do. But you want to use other things in that recipe to help promote this and help promote the skin healing. And, of course, we know about skin health, and most women, we know about it because we love our retinoids, right?
Right.
We see it every day. So what we have to do is remember, retinoids, really, what are they, John? Anti-inflammatories.
I'm listening to this, and I'm saying to myself, there's so many vitamins. How do you pick, or how do you know what you're going to do when, and where
John,
does this fit in?
I have several protocols. Yeah. My protocols are my protocols. What we need to do is go back and say, what is it that we want to accomplish for a patient? We know we want to improve their quality of life, right?
Yes.
How do we do it? Right? Sometimes we have to use vitamin C along with A. Sometimes we don't use vitamin A at all, right? So it depends on what I'm trying to accomplish for each individual patient. It isn't one size fits all in our facility. This is why I have so many nutraceuticals compounded for us.
And we're going to talk about vitamin B, vitamin E,
Yeah.
I mean, there's so many, and that's why I was wondering, how do you figure?
You have to figure out what's going to work for a particular patient in a particular time frame, and what is the challenge? What am I trying to accomplish? And of course, we need to have our docs on board, and we need to find out more importantly, the patient must tell me, what is your quality of life issue? Yeah, I've said this from now till the day we stop talking, John. Your quality of life issue is different than mine.
Right.
And people come in and they tell me, what is it? And that's what I want to know. How can I help each individual patient? And that's how you decide what goes in. What can effectuate the change?
Yes. And that's why the initial consultation is never 15 minutes.
Well, that's true.
Which is another story. So you were saying earlier, there's 2 forms of vitamin A?
Right. Okay.
So again, which one is?
Again, am I looking to help improve the quality of their skin, or am I looking to help the immune system? So again, you want to reach into that black bag. You know, we have a black bag too. It's just loaded up with vitamins, minerals, and amino acids, okay? So you go into the black bag, and I want to find out which one is going to work for my patient in this particular case.
I've asked you before, and again, I think it bears repeating. How do you know how this is going to work? I mean,
Just
do you have
listen,
any data to show?
Sure,
people?
I do. Listen, come on in. You know, right now I'm being plagued. I have people from out of town who are there. You've seen them.
Yes.
I have one who's being plagued by skin rashes. And actually, my good friend John is always calling about the skin rash that he had. And it was terrible because he really was able to do his own advocacy, something we can talk about, and talk to the physician about, did one of these drugs contribute to the skin rash? Yes, but sometimes the skin rash is organic. In other words, a patient has a skin rash to something, an allergic reaction. It's an inflammatory process. And we found that a certain form of the vitamin A will help in that kind of condition. So it depends on how you present, John. That's the bottom line.
Believe it or not, we're at the halfway point of the show. We have plenty more to talk about here.
Oh, we do.
Health Watch every Sunday, 8 till 9 here, Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. 855-839-1210 is the number here. If you have a question for Dr. Molly, 855-839-1210. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, Marlton, New Jersey. We both are returning with more of today's edition of Health Watch after these words.
This program is paid for by Innovative Medical Associates.
As always, operators are standing by at Innovative Medical Associates, and the number 856-489-0505, 856-489-0505. You call there and you will set up your appointment with Dr. Molly, the initial consultation. It is complimentary, doesn't cost you anything. And you might as well do it because you're probably wondering, I wonder if Dr. Molly can help. Well, don't wonder. Just schedule that appointment, 856-489-0505. And, of course, the website, innovativemedicalassociates.com, innovativemedicalassociates.com. That's the website. It is Health Watch every Sunday, 8 till 9, right here on Talk Radio 1210 WPHT. And the number here, 855-839-1210. We've been talking about the different kinds of vitamins because it's not just vitamin C at Innovative Medical. There are so many forms of vitamin B.
You bet. You bet.
14?
Yeah, roughly 14 forms. And when you look at it, most people think of B complex, and B complex is important. So you have thymine, riboflavin, niacin, pantothenic acid, pyridoxine, biotin, folic acid, which, by the way, is synthetic. I use folate. We have a particular B complex that is made with folate, which is what the body really needs. And people talk about B12 or cyanocobalamin. I have 3 forms of B12, cyanocobalamin, methylcobalamin, and hydrocobalamin. So people can have a genetic dysregulation where they can't take the certain B vitamins, and you have to switch them off. So how do I know about that? Well, we see the genetic markers, John, and therefore we can say this form of vitamin B is better for this patient as opposed to another. But let's talk a little bit of this. What happens is vitamin A and E, they're fat soluble, which means they're stored in the liver and the fatty tissues. But vitamin B's are water soluble. They're never stored in the body. So yes, when I hear the naysayers say, oh, but you're just urinating out your vitamin B and C. You're just urinating that out. Why do you need to get it? Oh, you need to get it, and here's why. Because you can't get enough from your food to really accomplish the task that the body needs. Let's talk about B1, thymine. Thymine's involved in the release of energy from the nutrients you eat. Well, if you have a poor diet, what do you think what's going to happen? What's going to happen? You're not going to have enough of it to actually release. And it's vital for the brain and the heart. They need a constant supply of energy, right? Poor memory, we've seen that. Fatigue are some of the signs of thiamine deficiency. Very important. I use thiamine a lot, John, for my neuro folks, and I use it along with what? Amino acids. So I don't just have vitamins in stock, John.
This is why you're a scientist, because I mean, really, this
you got to put them together.
Yeah, that's the complication here.
Absolutely. How about riboflavin? A small amount of riboflavin is done in the gut, but guess what? If you have gut dysregulation, forget about it. You're not getting any of that, okay? It's involved, it's a component of enzymes that breaks down fat, steroids, and medications, okay? So if you don't have enough B2 or riboflavin, what do you think happens? You don't break down the steroids we give you from outside either, okay? There's more. B2 deficiency as in skin rash, as I was talking about earlier. So let me tell you, one of the things I did for one of my patients, John in particular, was I made sure that we put enough of the B2 in there for the skin rash. We need to look at it. It's also involved in anemia, hair loss, swollen tongue, cracked lips. I see a lot of that. Niacin. Now, niacin is crucial for the digestive system, the nervous system, and skin health. It's a major component in something we use all the time called NAD, which, by the way, has just started to become very popular in the spas. But may I tell you that you better use it properly, okay? Because vitamin D, using NAD alone, may not really help the patient. They use it a lot. We've used it in our facility for detoxing folks from opioids and alcohol. Why? Because it's involved in cellular respiration, antioxidant, and what can happen, it can really, really help with brain function if you use it not alone, but with other amino acids. So the real key to this, John, is in how do I put the protocols together? There it is.
What is B12? Where does that fit in?
B12? Oh, B12, cyanocobalamin. Everybody talks about B12. Why? Why do you get a B12 shot? People want to come in and they want to get a B12 shot. For energy. They say, oh, okay, B12, right? It's for energy. Well, what happens if you have a dysregulation in a particular genetic function, MTHF, which says you can't utilize this cyanocobalamin? Guess what? I have two other types of B12 that will help you do this. And it helps red blood cell formation, brain, and nerve cell. You need B12 for your nerves. So here we go again. You've got to look to this deficiency of B12, or if you can't utilize your B12 and you have that genetic dysregulation, you need the different type of B12 so that the body can do this and get you out of the depression. We were talking about depression today.
Yes.
Right? Okay. So B12, yes.
I was going to ask you. So it goes to show that the particular recipe
yes.
is contained in.
You got to look at the forms of these vitamins. You just don't throw. Listen, there's a million recipes out there for IV therapies. There are. Go ahead. I have no problem with that. Little is good. If you use a recipe and it works for you, go ahead. But I'm telling folks, the way that you do this is you look at the particular patient, you look at the particular problem, and you look at what they want. What do I want to accomplish with the hydration therapy? That's how you put together your protocol. And you know I have a ton of protocol, but they're pretty unique.
Over
to us.
600.
Right, but they're all variations. Listen, there were a lot of smart guys in the 50s that helped me. I mean, I was only born, I was a baby in the 50s. They were doing forms of this back then. This is not a new modality, but I would say that the enhancements that I have been able to do over the 26 years makes this a wonderful medical modality.
Talk about vitamin E.
Vitamin E, there you go again. Okay, you didn't let me finish the B's.
Well,
but all
finish
right.
the B's then.
No.
The B's.
We'll go to vitamin E, my friend. Okay. Well, one of the things I want to say is, unless you're a science nerd like me, you're unaware that vitamin E is a collective description of 8 fat-soluble compounds, okay? And we affectionately call them alpha, beta, gamma, and delta. Classifications of 4. And then there's another 4 that are smaller, okay? So they're a fat-soluble property of the vitamin. What it does is it can be stored in the fatty tissues, right? So it doesn't have to be consumed every day. Among this, besides using this for liver, and it's a powerful antioxidant in that it breaks the chains of the problems of free radicals. Free radicals. You know, we talk about this all the time, you and I. Oxidative stress. Vitamin E is very important to stabilize that. All right? Very important. So, one of the process is that it breaks up and it goes for the free radical. It fills in the spot, and the process then is antioxidant in nature, very similar to vitamin C, okay? So when fats, we talk about this in terms of the fat soluble, when fats undergo oxidation, it generates the oxygen species, which is the free radical. So we need to use it. Vitamin E immunes what? Boost your immune system. Vitamin E, more than that, you've heard me talk extensively about phosphatidylcholine and phosphatidylipids present in the cell membrane, which are very susceptible to what? Oxidation. Oxidation gives us what? Inflammation.
And you've always said that's not good.
We don't want to do it. Now, here's the thing again, though. This goes to my theory of Goldilocks. We have to use it correctly because it can also impair platelets. It can be a problem. So what we have to do is, again, we have to use it just right, John. Not too much, not too little. And therein is the art of the medicine or the science of this.
And you have really got the science down
Well,
to
I try.
science.
I try. Now, if you have a vitamin E deficiency, what are you going to have? You're going to have a problem absorbing fat, right? You're going to have a problem. Those who have most of this, gastric bypass surgery, terrible, terrible. Every patient I've treated with gastric bypass surgery has had a problem with vitamin E. Crohn's disease, celiac, pancreatic enzymes, okay? Extreme dieting. And we have a diet program that actually is working pretty well. You've seen the results,
yes,
okay?
I have.
So here we go again. You can have muscle weakness. You can have numbness, tingling. We need to look at all of these vitamins. So it isn't just vitamin C in my clinic.
And with that, we have another break we're coming up on. It's our final break of the morning. 855-839-1210 is our number here in the studio, and we do have some open lines. So if you want to get in, you'll get in right away. 855-839-1210. It's Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. We are coming back with more of today's edition of Health Watch after these words. We are back here on Health Watch, 856-489-0505. That's the number for Innovative Medical Associates, and operators are standing by right now. And they'll take your call if you would like to schedule that initial consultation with Dr. Molly, 856-489-0505. And the website, innovativemedicalassociates.com. InnovativeMedicalAssociates.com is the website. And don't forget, if you miss any of today's show or you want to hear it again, we're on this afternoon from 4 until 5, our Health Watch replay right here on Talk Radio 1210 WPHT. But right now, it's the live version here on WPHT. It's 855-839-1210, the number here in the studio. And we got a couple minutes left, so if you want to jump in and ask a question or a medical challenge for Dr. Molly, 855-839-1210. And I know you're excited about this. There are some new tests developed for cancer patients?
You know what, John? One of the things that I try to stay on top of, I'm a member of 2 societies that are conventional, okay? As I tell everybody, we don't throw the baby out with the bathwater, right? So the bottom line is I get a volume of clinical chemistry, Evolutions in Laboratory Medicine. It comes out once a year. Right now, about a year and a half ago, and so I was telling people about the circulating tumor cells. If you remember, we're looking at proteins. This is in particular for our cancer patients. Right now, this volume that I have is 400 pages of the data that's being collected about the use of these circulating tumor cells for cancer patients to help prevent a relapse, because even though they may have removed the cancer, they may have removed the margins, whatever, we have these cancer cells circulating in our system. Now, some of the vitamins I spoke about in the earlier thing can help us possibly reject these from becoming tumors. We've got to really do this in a way that works. But there are so many new tests out, John. And I'm telling people, and you know I advocate for my cancer patients, John.
That's right. And you were talking about it the other day, and I just heard a little bit of the conversation. You were telling people, you have to be your own advocate.
That's right.
And you are the advocate for every one of your patients.
I tell them what I think they should ask in terms of their oncology treatments. I review the oncology notes. We're not oncologists, meaning my physicians who help me do these reviews, we're not oncologists. But I'll tell you what, we want our help. My whole job is to help a patient wherever they are, John. You know that. I have cancer patients who want to do nothing conventional. And then I have cancer patients who do a combination. What do I think? Well, I think it depends on where you are philosophically and what you want to do. And age, there's so many things to take into consideration. But the one thing I know is I want to help my patients' quality of life no matter which way they go.
And you have done that.
I don't know.
For 27 years.
I've done it for 27 years. And the thing is, there's a lot of tools out there, conventional tools, that I believe this again separates us from the spas. We need to look at all of that. We need to tell our patients some of these tests are available to you. You've got to ask for them. You've got to know what other new drugs are out there for cancer patients. We want to know that. We want to know about these immunotherapies. It's very important.
And if you don't know about it, you can't ask about it.
Not only can't you ask about it, and most times my patients are frozen stiff when they heard a diagnosis of cancer. I know how that feels. You're in a state of shock. You know how that feels.
Right. Without
advocacy, what happens? We go down the rabbit hole. And maybe that's not so good.
Talk about some of your patients.
Oh, man, this week I have 7 patients in from out of town, and you saw we were hopping, right?
Yes, yeah, you were.
Okay, and most of those folks who came in, they have some genetic disorders that we're looking at, why they can't really utilize some vitamins, minerals. Their nutrition is terrible. But you remember last week I spoke about the patient that had the problem with the mycology in his blood. Do you remember that?
Yes.
He started with me, and he's being treated with a conventional drug that eradicates yeast, okay, IV, because it's necessary, as well as what? We're giving him a host of vitamins and minerals that also will aid in his recovery. And by the way, he told my lovely Linda yesterday that he's doing exceedingly well. And this thing went undiagnosed for I don't know how long until we ordered a mycology study. This guy went through all the conventional studies, and they kept telling him it's in his head. Let me tell you, it's in his bloodstream, guys.
Yes. Yeah. How many times have you heard that from a patient?
A million times. Numerous, as they say in the laboratory, too numerous to count. Okay? Yeah. And that, John, is the crux of why you need sometimes to have an advocate. I'm also using a young man who's extremely depressed, very interesting guy. He had a genetic test. They only did half the genetics. Why in the heck would you only do that portion of his DNA? I don't know.
And do you ever get answers to these questions?
Like, yeah, I try.
Why do they do half the tests?
You know why? I think in conventional medicine today, particularly some areas of the country, they just decide that these people have problems that they conjure up in their head. If I tell you how many people come into me and tell me that their problem is related to their psyche as opposed to the physical, you know that. You've seen it.
I've seen
this doesn't just affect women. By the way, lots of the guys in the place say, it's mostly a women problem. No, it isn't.
No.
I can show you. Some guys come in and they say, this is in my head, he told me. Yeah, really? wake up, smell the coffee.
I can see, as you're talking about this, I can see some of the patients who have had, they told me, they said it was in my head.
Yeah, we've seen them all, John.
Yeah.
They come in to tell you the stories, and it's like amazing. The problem is, and the other problem I think we have, is that many times our patient has a fear of talking to their physicians. Stop that. They put their pants on one leg at a time, just like everybody else. I love my physicians. I know a lot of them. I had to bring in a specialized physician this week for one of my women who I believed had an autoimmune disease that was affecting her genitalia. Okay? Now, this is a mucous membrane. Everybody gets this. And I knew that this woman didn't have a sexually transmitted disease, blah, blah, blah. Guess what? I was right. And the doctor I had come in to do the exam said, "Man, Dr. Molly, you know how rare these cases are?" I said, "Well, just right now, I've seen 2 of these cases in the last 6 months."
It's truly amazing how many times you discover something. Desperation medicine. And what I would tell people, don't get like this, guys, because there's always another bus. Let's look, let's search, let's do it right. I can't just throw an IV at you and say, "Hey, it's going to be beautiful. It's holy water." Real quick, your patients from Indiana. Yeah. Where are they now? Well, they've got another week with me because, again, it's not holy water. It takes time for the stuff to effectuate the change. And a lot of them had some very serious problems this time out. So I would say that, they're doing as well as we can be expected since we had a snow day in between. The governor. We had 2 this week. Well, the governor apparently said one was an emergency day and you can't get out. So yes. I don't know. But I got to tell you, we worked through the initial part of the snow. We couldn't get in the next day. But, we're big on helping our patients, and that's all I can say. And you will continue to do that, and we will continue to bring you this show. God bless you. That's going to put the wraps on another edition of Health Watch. Don't forget, 856-489-0505 is the number. The operators are standing by, and they will be there well after we leave you at 9 o'clock. 856-489-0505 is the number. Don't forget the Health Watch replay, 4 to 5 this afternoon. You'll hear this show all over again. If you missed any of it or you want to hear it again, it's this afternoon, 4 to 5, here on Talk Radio 1210 WPHT. For Dr. Molly, Fantasia, and everyone at Innovative Medical Associates, the lovely Linda, and our nursing staff, Barbara, Lana, Donna, Vicky, and Daniel. Then there's Joanne, Delightful D, Fabulous Fran, and our medical assistant, Sandra. I'm your host, John DeMasi. Thank you for listening. We will talk to you next Sunday. Health Watch, 8 till 9 here on Talk Radio 1210 WPHT. And stay tuned for The Heart of Your Money with Joe Yakovich coming up in just a couple of minutes. Take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.